everybody, and welcome back to another in a series of videos. I'm Julie John, and this is Bob Rothbard from Rancho, Cucamonga Optometric Center. And today we're going to talk about vision and sports. Bob, what can you tell me about how vision affects our ability to play sports, or vice versa, how sports can affect our vision?
Well, more the first question, how your vision affects sports tremendously. Of course, seeing clearly, as with anything else, is important. Baseball, at night, if you're in center field and you don't have clear vision, you're not going to be able to see as clearly.
See that ball coming at you.
To see it coming, or as at least picking it up as quickly. But more importantly, eye coordination is a very important factor.
Oh, yeah.
With vision.
Show me
I was going to show you something. Come.
I get to do a demo.
Demo time. Here, Julie. Come across and touch my finger with both eyes open. Pretty good.
Okay.
Okay, one more time.
Do you want to do it this way for the camera?
No.
No. Okay.
It's going to be difficult. It's going to be difficult to do it that way. Okay.
Contact was made.
Okay. Now cover one eye, Julie. Either one. Do you think you can do it?
Yes.
Go ahead.
Even though I saw you move your finger.
Okay. Try it again. Stop. Take your hand down. And look at the difference.
Oh, wow.
Yeah. And that's normal. You do not have depth perception.
The first time I kind of cheated because I saw you move your hand, so I adjusted more.
Very good. You do not have depth perception with one eye closed. Now, this
that
is
affects you a lot in sports.
Well, think of it this way. I wasn't moving, you weren't moving,
yeah,
and the target wasn't moving. Everything is moving.
Oh, yeah.
And if your eyes can't lock on the target,
right,
there's a problem.
Oh, definitely. I can see where that would really affect you. You could get smacked in the head with the ball. Well,
yeah, or you can miss it. And think of it this way. If I can't think of help it with baseball. If you're like this and you do a closed stance and knock out one of the eyes instead of being both eyes toward the ball, your depth at picking up the ball might not be as keen.
Oh, definitely.
And being able to catch a ball, obviously, is very important.
It's all split-second timing, too, isn't it?
And shooting a basketball, obviously, can be a tremendous problem, especially from a free throw line.
Wow.
If the eyes aren't locked on the target. And there are some individuals whose eyes might not even be straight in sports and not able to perform as well.
And can you correct that, even if their eyes aren't straight? Is that something that can be worked on?
Well,
maybe with a pair of these?
Well, not necessarily, except there are people whose eyes aren't straight, and sometimes certain corrections will help. But, Julie, the problem isn't so much straightness, because most people's eyes are straight.
Oh, okay.
But as we referred to before in one of the other videos, if the eyes don't aim and focus together, there's a problem. And that part can be trained in many situations. There's a whole area of optometry that deals with sports vision. And there are optometrists, although I don't train we can refer them to certain, some of it we can deal with, but a lot of them we can refer for vision training to get the eyes to work more effectively together.
So you don't have any big names that you're going to drop in this part?
Well, I'd rather not drop any big names because I'm not 100% sure they actually did go through training, but I can think of some Major League Baseball players for sure.
Oh, yeah.
That did.
Tell me about sports and safety.
Julie, it's a very important topic. It's interesting. I have a lot of parents who have their kids playing soccer. And I say they're wearing eyewear protection. It doesn't even occur to them.
Are these some kind of a
protection? Those are safety eyewear. You can actually put a prescription, or they can be worn without prescription.
Oh, neat.
And the number one sport that comes to mind, especially with parents and the kids, is soccer.
Oh.
And just think about it. You get a soccer ball in the eye, there could be some major damage.
Oh, wow.
There could be detachment of the back of the eye called the retina.
Sure.
It could put a hole in the center of the eye, the macula. And these conditions could be permanent and can really lead to permanent loss of vision or substantial loss of vision with that individual.
You think only a hard ball will do that, but a soft soccer ball can do it too.
No, I don't see that many of them. But if you were to ask some of the retinal specialists who see these cases, refer to them time and time again, it's really important that a kid, and also if they're just wearing regular glasses, one of the things you got to be careful of in sports are these little nose pads.
Oh, yeah. In fact, I've seen where people got hit and they said, ow, and they grabbed their nose.
And the lucky doesn't go into the eye. And one last thing that's really important is the type of lens you put into a sports lens, or even sunglasses. And you wouldn't think golf, for example, could be a dangerous sport.
No, you wouldn't think
But
that.
I had a patient, I said, did you want polycarbonate lenses? He says, of course I want polycarbonate lenses. I says, why are you so emphatic about it? He says, because I got hit in the eye with a golf ball.
So
I
he
said,
knew.
He knew. He said, well, I said, how did that occur? He says, well, to be honest with you, I was in the sand trap, and I hit the ball, it ricocheted off the lip of the trap, hit my lens, knocked the lens out, knocked me out, but the lens never shattered. And I guarantee if that ball would have hit the eye, there would have been some serious damage, if not total loss of vision.
Or if the lens would have shattered.
If the lens would have shattered. So polycarbonate lenses are the safest against shattering. One of the things that is important to note, that a lot of sunglasses, and they're very attractive, I'm not going to name the manufacturers, some come with glass lenses. Now, glass lenses are treated, not to break, but they're by far not the safest. Polycarbonate lens, it's something to keep in mind if you're using sunglasses in a sports environment. Or for that matter, in a shooting environment if you're to shoot.
Oh, yeah, sure.
Because the ricochet and so forth can cause some major problems too. Another thing that's really interesting and very important in sports is peripheral awareness.
Oh, that's very important.
Just ask this one quarterback who suffered from a compound fracture about 15, 20 years ago on the Washington Redskins because he was blindsided by one of the linebackers of the New York Giants.
Oh, man, if you don't see a linebacker
and
coming at you, you've got some problems.
And just think about it. What happens, Julie, when you're under stress to your peripheral vision?
You know, I do think your peripheral vision, and that's so easy to say, reduces when you're under stress, because I can think of times in stress when I felt like I was in a tunnel. Much more tunnel vision, exactly, so you lose it. Now, one of the things that's interesting is when baseball players are in the groove, especially the batters, and they're really, I'm getting in the groove myself. Okay, not that groove, okay. When they're in the groove, they will say, hey, the baseball looks like a watermelon, or it just looks a lot larger. I've heard that. And they're able to hit it. And when something is perceived as bigger, it's coming to you a lot more slowly. Right, you have time to react. And your time reaction will be a lot better. Wow. That's really interesting. Just think in certain situations, driving, if you become tunnel, what would happen? Right. Or if you're a police officer and you're kicking down a door, and you become tunneled and don't see someone off at the side. So stress in sports situations can tunnel down the vision and therefore perception. There was a goalie, I believe, on one of the hockey teams. This was many years ago. After he went through training, he said, it looked as if the puck were coming at me a lot more slowly, and he was doing great. Oh, so that's really neat. Isn't that interesting? And does it have to do with relaxing a little bit and breathing and that kind of thing? Making sure that you're giving yourself time to react? Well, relaxation is part of it, but you burn more energy there's more nerves per muscle fiber in the eyes than anywhere else. Oh, I've heard that before. That's fascinating. So if they're coordinating better, you're not going to be as fatigued. So this is something to think of too. So the eyes really are the key to a lot of things in your health and your sports performance? I really believe it is, Julie. That's fascinating. Well, thank you, Bob. This has been a great segment. Thanks, Julie.